I have Dr. Joshua Clayton, State Epidemiologist, and Kim Malsom-Reisen, Secretary of Health, with me to provide today's update. I'll go ahead and turn it over to Dr. Clayton, and then we'll take your questions.
Good morning, everyone. Today we are reporting 95 new cases of COVID-19 in the state. This does include 13 new hospitalizations, 0 new deaths. We've had 94 individuals who have recovered from COVID-19 and 1,721 new negative tests that have been performed. This does bring our total of COVID-19 cases in the state to 5,162. Of those, 1,016 are active infections and 4,084 are considered recovered. We have 87 individuals who are currently hospitalized and a total of 62 deaths. A total number of tests that have been performed include 43,500 individuals have tested negative. For the new cases by county, we have 1 in Aurora, 32 in Beetle, 3 in Brookings, 5 in Brown, 2 in Brule, 1 in Buffalo, 1 in Coddington, 4 in Davison, 2 in Edmonds, 1 in Fall River, 1 in Hand, 1 in Hanson, 3 in Gerald, 1 in Kingsbury, 2 in Lake, 1 in Lincoln, 1 in Lyman, 15 in Minnehaha, 1 in Oglala Lakota, 16 in Pennington, and 1 in Union. For new cases by age range, we have 14 in the 0 to 19 year age category, 20 in the 20 to 29 year age category, 15 in the 30 to 39 year, 16 in the 40 to 49 year, 10 in the 50 to 59 year, 12 in the 60 to 69 year, 6 in the 70 to 79 year, and 2 in the 80 and over category. For new cases by sex, we have 35 that are male and 60 that are female. For our clusters, we have 137 of the 161 cases in Demkota have recovered. For Jack Links, we have 43 out of 84 that have recovered, and there are no new updates to the Smithfield cluster data for number that have recovered.
All right, I'll unmute our lines and we'll take your questions. We're ready for your questions.
Morning, JP from KORN News Radio.
Go ahead, JP.
Thank you very much. Once again, looking for an update on how the mass testing is going on with the nursing homes and assisted living facilities, and how many more tests do you expect to run during this time?
JP, this is Kim Malsom-Reisen. So as of this morning, we have results back for 5,226 residents and 7,613 staff for a total of 12,839. Our rate of positivity still ranges in that less than 1%, in fact, less than 0.5% range, so we're pleased by that. We are still working on getting through the tiers 3 and 4 assisted living facilities, and so we expect to see the numbers of total tested increase in the coming week and a half to 2 weeks.
Will that then wrap up the mass testing at these facilities?
Yep, that's correct. And then they would move into sentinel testing, which is a small number of randomized people that get tested on a regular basis so that we can try to detect COVID before it becomes a big problem.
And if I could follow up, once this massive testing is done, do you plan to do any more locations or different facilities around the state?
So we are currently working with different tribes that are interested in doing some mass testing in their communities. We are also working with the next group of facilities, which will include larger congregate care facilities outside of long-term care.
Thank you.
You're welcome.
Next question. Any other questions? All right, well, hearing none, thank you for joining us today, and we will talk to you tomorrow.
Thank you.